Hello, good evening, and welcome to the Functional Podcast Solution class. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and with us we have Dr. Kim.
Hello.
And so every Wednesday evening, we created this class for each one of you to discuss the functional root causes approach to chronic conditions and what strategies you can utilize to help your patients. And in the spirit, of course, of diving deeper into understanding what's driving the disease, I asked Dr. Kim to join us. Dr. Kim has years, I would say probably over 2 decades of experience with patient care. She's a nurse practitioner with years of experience, and has been serving her community as a primary care practitioner and also a functional medicine practitioner. So, Dr. Kim, thank you so much for joining us.
Yes, thank you. It's good to be here as always.
Yes, absolutely. So hopefully everybody's having a good week so far. I know things are getting busy with the holidays, so we always appreciate that you are here with us and learning, developing your skills. And as usual, our goal is to talk about the root causes. And by root causes, I mean the epigenetic factors, everything in our environment, externally or internal environment, that can contribute to chronic diseases. And typically we focus on a very specific condition or a symptom. And today we wanted to do something a little bit different. We started this case study series as sort of a virtual rotation last week. And today, Dr. Kim has prepared for us another very interesting case, real patient from her practice, to show you how she integrates functional medicine, integrative medicine, and primary care all together. And so this is going to be really interesting. Now, the topic that we picked for today is treating autoimmune conditions, patients with autoimmune conditions such as hypothyroidism, which is often caused by Hashimoto, and rheumatoid arthritis. And what's the connection to the gut dysbiosis or gut dysfunction? So we're going to talk today about a lot of very, very interesting topics, and we're going to dive deeper in how your patient's gut can contribute to the development of autoimmune conditions. So if you're interested in learning more about the root causes of chronic conditions, learn how to help those patients who continue to struggle, and strategies to improve their health and function, help them feel better, function better, you're in the right place. So, Dr. Kim, I know that this is coming from a primary care perspective, right? There's 3 things that we wanted to mention in the beginning, right? Which a lot of practitioners, I'm assuming also that includes yourself, that have been in the sort of standard of care or primary care, right? The pill for every ill approach, are looking for functional medicine, right?
Yeah, definitely. Because they're not getting the relief they want. They're not feeling what how they would like to feel. They're not optimal.
Mm-hmm. Yes.
And they want more than primary care can give. I mean, it's just, primary care, again, shorter visits, less time with the patient. And so much of what we see and treat in primary care, these chronic illnesses, are lifestyle and functional medicine. They need lifestyle intervention to really, really fix the root cause, right? So yeah, people are hungry for functional medicine.
Yeah, and I'm sure that as many practitioners have seen before, you get a patient's lab, they show up, they complain about fatigue or joint pain, or they have a certain condition. You look at their labs, and their labs are normal.
Yeah.
Right.
Yeah.
So that is one of our biggest challenges, telling patients, well, on paper, everything looks okay, but the patient's telling you, I'm still struggling.
Mm-hmm.
Right.
Right. And often on paper, it's like these really big, large labs that, yeah, maybe they have a complete CBC, a normal complete blood count, a normal metabolic panel, and maybe labs, but there's underlying things that functional medicine can look into, and then some of those tests don't look so normal, So, but yes, so to see like, one example, and I don't want to get on too much of a tangent, but I will see a lot of primary care providers order venous magnesium levels. Well, that magnesium level, if it were off, if a venous magnesium level is off, the patient's going to be really sick, like probably in the ICU. So, red blood cell magnesium is where we need to really be measuring for magnesium deficiencies, not, so it's like so many of these big labs don't show much because the patient isn't really, really ill, but they have all these underlying functional things.
Yes, and that's one of the biggest changes, biggest differences between looking into the more functional aspect.
Yeah.
So, and standard of care. So, in standard of care, you might test levels of B12 or magnesium or vitamin D, right, in the extracellular, right? But
Yes.
But in the functional medicine approach, we understand that doesn't tell us anything about the utilization of these, and even in many cases, those levels are not accurate because they shift during all the time, right? There was one interesting study that showed levels of zinc intracellular and extracellular in patients with infection. And they saw that if a practitioner is counting on the zinc levels in the blood, then they would show adequate levels, but their cellular levels depleted significantly during the infection, which indicated that there's need for optimization with extra zinc, with zinc supplementation, right? And that kind of takes us to the clinical application, which there's interesting COVID studies that show that when you actually supplement with zinc to patients with the COVID infection, they get better results. They get less complication, mortality rates is reduced. So I'm so glad that you brought that as an example for how a functional trained practitioner can see so much more of the picture than a provider that is trained in the standard of care. Not to say that
it's bad.
It's bad, but
just it's a different focus. There's acutely ill, like in the intensive care unit ill, and then there's chronically ill, where we need to do deeper dives, and that's exactly what functional medicine does.
Yeah, and primary care is designed to and very important for let's call it patch them up or and send them home, right? It's like let's manage them
or early detection.
Or early detection of diseases, right? Potential diseases, really important. But when a practitioner, and this is something that I always explain to patients, when you want to focus on finding what's causing the disease, the question is like not how do we manage symptoms and conditions, but what's causing it, and how can we optimize health, which we're going to talk about today with this interesting case that you brought in. That's where we want to go into the functional or integrative medicine. We're going to talk about both approaches. And I'll probably add something to that, to what you were saying, is that this is like an example, right? When you see a patient with an autoimmune condition such as rheumatoid arthritis, the standard of care approach is to try to use immunosuppressive medication, right? So we're trying to suppress the immune function, right? From a functional medicine perspective, we're asking a different question. What's causing that immune overactivation?
Yes.
Right? Because that will help us to not only maybe use less of the suppressive drugs, but also get them to remission, which I've seen so many patients get into remission while we as we kind of figure out working on the root causes. And then, of course, from an integrative perspective, like an integrative health practitioner will ask themselves, how can I manage them in a more maybe natural approach, maybe improve their immune function, supplements or nutrition. So we're going to talk about both, because functional and integrative are both really important, two sides of the same, let's get them better, right?
Yeah.
Yeah. And then, of course, I'm sure every practitioner has seen the potential side effects of medications, right? You prescribe, patient comes back, they need more, they need a different drug, they need, something comes up. So that's why that's a big part of why I'm really excited about this case today, because, and I think a lot of practitioners can learn from it. So, so take us into this interesting case study.
Okay, will do. So the situation here is I had a 50-year-old postmenopausal female, and she had a diagnosis of hypothyroidism and rheumatoid arthritis. And this was, she was coming to me, actually, she had moved, I'm in Minnesota, so you know where I'm at. And she had moved from California. So she was transitioning care from California to Minnesota. She had been seeing a functional medicine provider there, along with her endocrinologist and her regular primary care. So she kind of had 3 different hats of providers, if you will. And she came to me saying, hey, can you, take the place of my functional medicine provider? I said, yeah, and your primary care if you want, because I do both. So I I'm taking over that. And then she has a endocrinologist that she also sees now here locally in this state. So she's moving care over. And when she was establishing care with me, she wanted me to take over some prescriptions and things that her primary had been doing. But every new patient, I do a functional medicine intake. Well, she thought she was really feeling pretty good, except for as we dug deeper into that functional medicine intake, which, you guys, it's so important, that intake makes people think about things that they might not otherwise be thinking about when they go through the checklist of, oh, maybe I have this bugging me and I didn't realize it. So she had gas and bloating that was actually bugging her. And she's like, you know what? It's actually getting worse, I think. And she goes, I don't really think about it much because I feel so good. Now, remember, she's already on a functional medicine regimen of supplements that are supportive. She's regular exercising. She's not obese. She's eating healthy. So she's doing almost all the right things. She is on some medications for her hypothyroid and her rheumatoid arthritis. Okay. So she's not like in a dire situation where she's reaching out to me to really fix me. This came up in the intake. And she goes, the more I think about it, I do have some symptoms of indigestion. I do get occasional heartburn. And again, she thought, well, maybe it's actually getting a little bit worse. Maybe she thought it was just the stress from moving. Who knows? So again, she's on hormone replacement therapy and the autoimmune medications and a host of good supportive supplements that I would say, yep, let's keep these going. And you'll see what I end up doing with her. But I wanted to focus in on, she's having some GI stuff. And we know that, GI can be directly related to autoimmune things, right? That gut-brain connection too. So I wanted to dig a little deeper. I think I went through I'm just looking at some of my notes here. Her labs that she had done, she had some general well labs done. Now, she also, with this move, had labs ordered by the previous provider, and then I interpreted them because she got here and then the lab done. So with that said, she had some general well labs done and hormones just from just the regular lab. I even actually reordered and rechecked those. And what we saw at the time was a normal CBC. Does that sound familiar? We were talking about that earlier. So normal complete blood count, normal complete metabolic panel, normal lipid panel, Her vitamin B12 was 451. Now, I like to see that vitamin B12 over 600 if I can, and not obviously over 1100. But I like to see it a little on the higher end, but it wasn't horribly bad. Again, she was on a good supplement regimen. Her vitamin D3 was 83.9, which is optimal. Like 60 to 80 is optimal. So, we're doing pretty good with things so far. Her thyroid levels were all normal on NP thyroid. Now, NP thyroid, for those of you that are prescribers, you'll recognize it as it has natural or like porcine derived T3 and T4. And so she has Hashimoto's thyroiditis. She does have that autoimmune disorder. And because of that, she takes NP thyroid. Now, she notices that she has better energy on NP thyroid versus like levothyroxine. Quick pharmacology lesson here, 101. Many of you already know this. So sorry if you already know this, but levothyroxine is T4. T4 turns into T3 in the body, and T3 is that active hormone that's out there going and actually making you feel the feels that the thyroid hormone does, right? Doing all the functions. So she's on both T3 and T4, and many times I see patients feel better when they're on a little bit of T3 and T4 because T3 is that active hormone. The most of the time you're going to see T4 of levothyroxine prescribed. I'll come back to camp here. Her other hormone levels, meaning progesterone, estrogen, testosterone, and DHEA per the venous levels were all in normal, optimal range for postmenopause. So she's postmenopausal. So, in functional medicine, we're always asking about what is the root cause. And so, again, I'm thinking of this gut immune axis with her. I'm like, she's having all these gut symptoms and she's got 2 autoimmune disorders. Like, there's got to be a connection here. So we'll do a little quick quiz here. So here's the question. Which of the following describes There we go. Hope everybody can still see me. I'm so sorry if I'm having any internet issues here. Here we go. There's the quiz. Which of the following describes the communication between the gut immune axis? Sorry. Is it A, the liver and pancreatic enzymes and immune function? Is it B, gut microbiomes in the immune system? Is it C, digestive hormones in the immune system? Or D, the pancreas and the vagus nerve? So I can't hear you guys out there, but what I can tell you is it's B, ding, ding, ding. So if you answered gut microbes or gut microbiome and the immune system, you're right. So the gut immune axis refers to that powerful 2-way communication system between the GI system and the immune system. To better understand it, we have an illustration here. This was a study published in 2020 in the International Journal of Molecular Sciences. So this, I go over this so frequently to explain to patients what it means when we have an unhealthy gut lining or leaky gut. And it's interesting because if you go to Google like an ICD-10 code to diagnose someone with leaky gut, you won't find it because it doesn't exist. So it's technically not recognized very well at this point by Western medicine, but we have plenty of science to show it's there. And this illustration is one of my favorites. I always highlight that, we have these external factors that are always playing a role into the lining of our gut, into the health of the lining of our gut. We have stress, right? Stress can raise certain hormones and cause problems that will disrupt gut mucosa. Different toxins that you intake, anything from alcohol is a toxin. Think of it like that. Junk food, empty calories, things that you put in your body, put on your body, even through your skin might have some toxins, right? So those things, pathogens, viruses, bacteria, and the different food particles, drugs, infection, all of these things can affect the gut lining. Now, if we go into this intestinal mucosal cells, and do you see these beautiful little goblets? They look like goblets, kind of. So I don't know if you guys can see my fist, but I always tell patients, think of your lining as these two cells. These two fists should be real tight, so you can't fit anything through. So if you look at those tight junctions, you just can't really fit anything through. But when we have a bad or leaky gut, unhealthy lining, there starts to be a gap. And things that are supposed to get expelled from the body, guess what? They leak and leach into the body. So the different toxins, pathogens, food particles, parts of drugs that we're supposed to be excreting through the stool, we're reabsorbing into the body, and that can cause disease. So I find that so fascinating too, that I really think one of these days Western medicine's got to get with it and recognize this diagnosis. I mean, how can you not? It's right here. So that's kind of the gist of that. Because nearly 70% of the body's immune cells are housed in the gut lining, you guys. Anything that disrupts the microbiome, like these things that we showed up there, pathogens, toxins, any of those things, poor diet, they can directly influence the immune balance. In a healthy state, you have a robust and balanced microbiome, and it helps maintain intestinal barrier and regulate immune tolerance and prevent inappropriate immune activation. However, when that microbiome is unbalanced and those tight junctions leak, right? When all of that happens, it leads to problems with microbial antigens or toxins that cross into the body. And that triggers chronic immune activation and systemic inflammation. And then over time, that is what can contribute to that autoimmunity and symptoms far beyond just indigestion, including joint pain, fatigue, hormonal imbalance, mood changes, neurological impact. It's really, your gut they say your gut's your second brain, and it's so true. It's your immune system and your brain. You produce more neurotransmitters in your gut than in your brain as well. We should probably, I guess, reserve that for a different talk, but it's quite amazing, the connection here. And it's really something to be considered, especially with her. So moving along, she had already had an order of a GI advanced microbiome test by US Biotech. Now, that is one lab you guys can go with. I mean, you're going to find that you're going to have your favorite labs. I absolutely love Genova Labs. I have no vested interest, but I love the Genova GI effects. It shows just about everything that this same test shows. So I didn't order this test for her, but she had already had it done. So I'm like, let's work with what you had, right? So it's a nice workup of the whole microbiome. It lets us know if she's got infections, potential pathogenic overgrowth, and it lets us know kind of the commensal abundance and commensal balance of the bacteria. So let's talk about some of that just to break it down. So commensal, if we think of bacteria in the gut, we hear the word commensal, think community, right? So your community of bacteria in your gut. We look at a couple things with these tests. We look at abundance, how much bacteria is there? And then we look at balance. Is it balanced? Are there infectious bacteria? Are there overgrowth? So one thing that we saw with her is she had an overabundance of microbiome. So her commensal abundance was high. She had a lot of extra bacteria in her gut. She wasn't in that nice green zone. So she was overgrown with bacteria. On top of bacterial overgrowth, which is also dysbiosis, right? Because it's not a good balance. She's out of balance. She's overgrown. She also had some infectious things going on as part of this microbial growth in her gut. So she actually had a couple parasites and worms show up, and that will show up on this type of test, this GI advanced microbiome. It also will show up on other tests, functional medicine tests that do GI microbiome testing too. Again, I like the Genova GIFX. You guys can take a look at several labs and kind of, I'm sure you'll find your favorite. But anyway, so she had tested positive for blastocystitis hominis, and I can't say the next one very well, but it's Dientomoeba fragilis. So I'm wondering, how long has she had these parasites? Well, she said when she thinks about it, she hasn't really had a good feeling gut for years, And so it's hard to know when she became infected with these parasites. She could have had them for decades. Who knows? But at least we know they're there, right? So those parasites are causing an immune reaction in her. That's a hyperimmune reaction. They're probably wanting to get rid of it and they can't get rid of it. Well, a hyperimmune reaction means then we have a high risk for autoimmune problems, don't we? So I think that we're seeing something going on here. And then for bacteria and viruses, she did have quite a bit of bacteria overgrown, no viruses, but she had some overgrowth of Enterococcus, Methanobrevibacter, Desulfobria, Citrobacter, a couple Citrobacter species, and a Klebsiella species. So some of those were, some of them are good bacteria. Some of them are potential pathogens though, because there's too much of it. On mycology, she didn't have anything show up, but that doesn't mean that's always the case. I've had several people show up growing yeast or fungus usually yeast in their gut. So mycology is like a fungal culture for your gut. She did not have that going on. So basically, we've got to balance her gut. She had major dysbiosis, like on the scale of like 0 being none and a good healthy green score and 10 being red. She's like 10 being red. Genova has a 0 to 10 system. That's another reason why I like them, but she was in the red. So we're going to talk about the specific treatment protocols that I used for her in a minute. But before we do that, we wanted to talk about more about that connection between gut pathogens and chronic inflammation. And if you want us to go over, your patients with you and look at labs, remember we do have coaching. So we have our functional medicine program comes with those coaching calls. And I would invite you to certainly book one with me, Dr. Chill or Dr. Asia. We have a lot of fun on the coaching calls. And I always send a recap of whatever we come up with for the patient, and it's a good time. So I'll let Dr. Tal take it over now, and he's going to talk some more about gut health.
I appreciate you mentioning the coaching call, Dr. Kim, because I know we got some really good feedback. A lot of the practitioners, nurse practitioners, physicians, registered nurses, pharmacists, they're just really enjoying that one-on-one connection and be able to talk about their patients. I know that some of them even shared with me that they brought themselves as a patient, which was interesting, right? I did that too. So I so I totally get when I first got a mentor for functional medicine. I was like, I want to go first, right? I want to figure out I want to figure out what's going on with me, if there's something that I need to improve. So I mean, why not, right?
Why not?
So, and there's also something interesting that you mentioned I want to talk about, which you said she felt better on T4 and T3, right? The NP thyroid, which tells us that there's possibly an issue with conversion. So every time we hear that like I gave them levothyroxine, but then the NP they were switched to NP thyroid and they feel better, we got to ask ourselves, wait a second, something here in the conversion of T4 to T3 is not working well. And obviously we're not going to get into that because that could be like a 4-hour class easily. But there's so many things they can look into. I just did a video on that last Saturday. I posted it last Saturday. But
awesome.
Liver conversion. The conversion takes place in the liver, in the gut, which we're talking about the gut, kidneys, And then also nutrients, like if the patient doesn't have sufficient amount of selenium, zinc, vitamin D, they're not going to convert well. And then, of course, if they have an autoimmune condition or inflammatory condition, they are going to convert T4, but not to T3. And I'll just pause here. And if you want to learn more, you can either log into the platform. We have a 4-hour training on just thyroid hormones and conversions and all that's the cool stuff. But you can also check out the Saturday email, which we posted to everybody. And then gut mycology, that's a really interesting one. So when I first learned functional medicine, it was years ago. I started kind of getting into it maybe 15, 16 years ago. Went through 3 training programs. And what they forgot to tell me is something that you just told everybody. That was like your pro tip, right? Which, I learned about it in 3 different functional medicine programs. And I started testing patients and doing these like expensive tests and whenever it was indicated. But then nobody ever told me that it's actually rare that you're going to find fungi in stool analysis. Like when I started testing patients, I'm like, wait a second, they don't have it. And then one patient, like she had the signs. She had this she had these like skin patches. We sent her out to a dermatologist, came back. It's like, okay, it's fungus, right? And then we started looking at her other symptoms like brain fog in the morning, like different symptoms. We're like, okay, wait a second. There's like signs of inflammation here. Like something's going on here, right? So then we did a 3-day comprehensive GI. It's a different lab that does that. But we did a 3-day instead of 1 day. And guess what? In 2 out of 3 days, they found the fungus in the stool sample. So then it came back positive. So I'm so glad that you brought up the fact that you just mentioned that, with some patients it wouldn't show. And that's because most functional medicine trainings are training you to test 1 day. And it's insufficient because in some bowel movements or stool samples, they won't see it. Yeah. So that's just something I wanted to put out there. So if any of you see patients, you suspect that there's things going on in the gut, but you're not getting the answer you're looking for, then maybe the 3-day might be a better approach.
For sure. And Genova has the 3-day. And this patient did not. This patient just did the 1 time.
Yes.
But I am totally with you. Yes, you're going to get more information.
Yeah.
More days.
Yeah. And of course, I mean, you already found a lot with their lab, the current lab test that you already had. So at that point, I would probably do the same thing because I'm like, well, there's no point of spending more money on labs where you already have here. We can save them a few hundreds of dollars on those labs. That's great. That's even better. And you already found a few things that are, and I love the picture you showed by the International Journal of Molecular Science because that shows it really nicely with the gut. So let's talk a little bit more about. Let's dive a little bit deeper into the gut immune function. So this is, and then we'll come back to what sort of integrative solutions we can look into. So this is from the journal Gene in 2023. So I wanted to show you guys this really interesting image because it's a slightly different way to look at healthy dysbiotic and inflammation. We'll hopefully make a better connection for what is how do these patients develop? What's these epigenetic factors that lead to the development of autoimmune conditions or chronic inflammation? So let's go from left to right. On the left side, and it's hard to see, so I do apologize. It's the biggest that we try to put it on the screen, but essentially on the left side you see the gut, and so the gut lumen. So you see all these different bacteria on the left top, which says healthy. And essentially, as Dr. Kim mentioned, we want a diverse and balanced gut microbiota. That really is what helps us to do the natural immunomodulating physiological function that our body is supposed to do. right? So our body has this innate wisdom, or whatever you want to call it. It has a symbiotic relationship with those bacteria. They secrete. We eat certain foods like fiber. Dr. Kim is going to talk about fiber as part of her treatment plan. And now you understand why. Because fiber, when we eat fiber and we have the good bacteria, they go through a fermentation process and they secrete short-chain fatty acids. So short-chain fatty acids, or in this study, it's specifically marked as metabolites. And those help to regulate the immune function. Now, of course, they have other functions in terms of their metabolism and helping us keep a healthier body weight, which we're going to get into more in January in the functional weight loss. So some of you already enrolled in that program, in functional weight loss certification. So that's where we talk more about like gut or immune or environmental factors or everything related to metabolism. But just remember for now that it helps suppress, those metabolites help to suppress inflammation. And there's a lot of stuff, different stuff that they produce. They help produce the production of secretory IgA, and a lot of what I'm talking, a lot of the medical, the biomarker terms that I'm mentioning right now, you can actually test. So when you order a comprehensive stool analysis, you can look at your patients' short-chain fatty acids, or, well, how much secretory IgA do they have there? So that'll give you a sort of a marker of what's going on. How much inflammation do they have? How much metabolites, beneficial metabolites they have or they don't have, they're lacking. So that's the clinical pearl, and this is why we explain the mechanism and how do you see it on the lab. Second stage is the dysbiosis. We're now in the middle. Dysbiosis is where the gut microbiome is disturbed. And you saw a really great example when Dr. Kim was talking about showing you the lab result of this patient, right? So this patient has probably 2 autoimmune conditions: Hashimoto, which is the major driver of hypothyroidism, and the second one is rheumatoid arthritis, right? And she's already on drugs to manage rheumatoid arthritis and hypothyroidism, but she's still fatigued. She still have gut issues, and it's mostly because most standard of care practitioners are not trained in functional medicine, so they're not making that connection. They're not making the connection between the gut and the autoimmune conditions. But you're going to be the person to be able to identify that for your patients, right? So in dysbiosis, we're looking at this as disturbed microbiome balance, which again could lead to a diminished production of those important metabolites, right? The short chain fatty acids. So now your patient has less of those anti-inflammatory metabolites, and they have not only they have a imbalanced bacteria, they have pathogens in their gut. So now they got less of the anti-inflammatory metabolites, and they got pathogenic microbes that stimulates more immune activation, right? Now we're switching to, so now we have production of inflammatory cytokines, interleukin-6, interleukin-1 beta, all that stuff that you can see in the picture. We're starting to shift our body to completely pro-inflammatory status. And then comes the inflammation, right? So this is like a full-blown systemic inflammation. That's the phase on the right side. And in these states, essentially, the immune tolerance breaks down, right? That's where the patient starts to experience symptoms of inflammation or pain. Sometimes it takes weeks or months until the patient actually starts to notice those symptoms. And that's where if you test, you also can see how many of these immune regulation mechanisms fail. Like they got a decline T regulatory cells, they got IgA mediated tolerance, there's higher amounts of inflammatory cytokines. So that's, again, where is the patient in these phases? Typically when they come to see you with an autoimmune condition that is related to their gut, it's already been several months or probably even years in the making. Kind of like Dr. Kim was saying, who knows when the patient got those pathogens, right? Who knows? I mean, it could be 3 years ago. It could be like, 10 years ago, 20 years ago, right? So that kind of summarizes this topic. And of course, there's a lot more that we want you to dive deeper into when it comes to gut integrity and function and the different enzymes and digestion and all that stuff beyond what they teach you in either nursing or medical school. There's a lot more that we can look into. But I wanted to dive into factor number 2. So now that we understand, okay, functional medicine wise, we talked about the gut, right? Let's talk about integrative health. So this is factor number 2. And we do a lot of it, a lot of integrative health or integrative medicine. And integrative health, we want to focus on 3 things. 1, when the patient comes to see you, they're looking for solutions that other practitioners were not able to provide. In this case, these patients were seeing, she had a functional medicine practitioner she was paying for. She had a primary care provider. She had an endocrinologist. She had like a team of professionals, but she was still struggling with fatigue. She was still struggling with GI symptoms. So the first thing we want to do is ask yourself, how can I address the patient concerns as quickly and effectively as possible, right? And we want to do that because that's what brought them to your practice. If you just tell your patient, listen, I'm going to be looking at the root causes, try to figure out what's causing your disease, blah, 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 right? It's going to take 2 to 4 months to figure it out, work on it, start getting better results. The patient, right? We want to get in the first month, we want to get the patients as many feel-good wins as possible, because that increases their motivation, that increases their trust in you. So if I go to a practitioner and I got bloating, I got this, but I also have other conditions, yeah, long-term approach treatment plan is important. But we also got to have the patients, we also want to have integrative strategies available to you so you can quickly say, oh, you got bloating? Okay, I got something for that. Not a prescription, but maybe something more natural, digestion enzymes, certain digestion support product that can help them, right? That also improves function, not just health and function, not just another drug, right? Oh, you got chronic pain, or you got fatigue, or you got inflammation. Let's put you on an integrative protocol for that. So you can educate the patient about dietary and lifestyle strategies. You can talk about supplements. You can help them create healthier habits. So now as time goes by, they improve one aspect of their health or lifestyle or dietary, and that helps to reduce inflammation. That helps them feel better, right? So I'll give you an example. It's easier if we just apply it. So in this case, when we see a patient like that, we know that the inflammation can drive the fatigue, they drive the chronic pain. The inflammation can do a lot of damage in our body. So reducing inflammation with omega-3 and curcumin, as an example, is a clear example of such a strategy. So if you see a patient with rheumatoid arthritis or an autoimmune condition, the first thing we want to do is, how can we reduce the inflammation, reduce the pain? So let's take a look at this illustration from the published study Frontier in Pharmacology. This study was published in the Journal Frontier of Pharmacology in 2024. So I chose this picture because it's very clear. You can see on the left side, the intervention was curcumin, and on the top, you can see what curcumin inhibits, right? Which inflammatory mediators or cytokines are inhibited there. For example, interleukin-1, 6, tumor necrosis factor alpha. And then on the bottom, you can see what curcumin promotes, which is anti-inflammatory cytokines such as interleukin-10 or Tregs. And so this is really important because curcumin is one thing I can do to start helping the patient shift their from pro-inflammatory to anti-inflammatory, right? And And so we're looking, and here also they talked about the M1 phenotype or M1 macrophages, which drive cytokine release and joint damage. And curcumin can also stimulate the tissue repairing M2 phenotype, the M2 macrophages. So this is an example, a clear example of how we use botanical medicine to support the patient's recovery, help them shift the inflammatory pathways function into, and slowly, as we find out the root causes and address the root cause, which in this case was the gut, then we can help them to, and I've seen patients go into remission by combining those integrative and functional approaches. But I wanted to show you this study because it was really cool to see it. Now, there are specific studies. I'm not going to get into dosages, and this is just as an example, but there is one study that showed that patients were taking 500 milligrams all the way to studies that showed that patients were taking 1,500 milligrams a day, and it gave the equivalent reduction in pain as taking NSAID as 1,200 milligrams per day. So this is a great approach. So always think about what can I do to help them today. That's what we include integrative health strategies, supplements, diet, lifestyle changes. And what can I do to figure out the root causes? That's more of a long-term strategy, right? So let's take a look at the next picture, which is kind of how this is like the clinician's flow for integrative care. This is something that we kind of like the flow that we always talk about. And so first we want to ask, when a patient is in front of you, what's causing those symptoms? What's causing that condition? We want to go beyond just telling the patient it's genetic or old age. Second thing we want to do is educate the patient. You have a suspicion that it's in the gut, it's something in the gut, right? They got maybe symptoms of bloating, they got constipation, they got loose stool for a long time, they got something's going on there. Okay, let's educate the patient. Maybe have them order the appropriate lab, and then pick number 3. Pick simple lifestyle adjustment. That could be like one thing, right? And Dr. Kim is gonna mention, we're gonna go into treatment protocols in a second now, and she's gonna show you exactly how she integrates lifestyle. Dietary guidelines are really important, and then specific strategies we can utilize from today to help your patient feel better. So that would be, for example, supplements. So Dr. Kim, let's take a look at, take us into, and I really love this functional and integrative treatment protocol that you've picked for this patient, because it's a really nice example, right, of how, how you utilize both. And I know that you have years of clinical experience, and you're also certified in functional medicine with our academy. So I know that this will be a really nice example to, we always get practitioners ask us, like, how do I do functional? Do I integrative? Like, how do I build this? How do I build this into primary care? So this is going to be an awesome example.
Yeah, like, how do I weave? It's like weaving it in.
Yeah.
But you definitely can. And so I always like to talk about kind of the whole, like, we're treating the whole body and the whole patient, right? So yes, a big thing is testing, and a big thing we do is supplements, but it totally doesn't end there. We've got to talk about all the stuff, right? So the thing that I wanted to do with her is I said, we have to do this remove, replace protocol, and I don't know where you guys are at now in your functional medicine journey, but when there is severe dysbiosis, especially where there's a lot of abundance, so microbial overgrowth and or infection, we need to do that GI remove phase. And when we talk about removing, we're removing the overgrowth of maybe some good bacteria, but it's too much. And we're certainly talking about removing any pathogenic bacteria or viruses or parasites or fungus or yeast, right? So we remove it. And so she needs to do the step 1 remove phase. And that's what I call it with my patients. It's step 1 remove phase. And I let her know, like, and there were pages of that test that I would love to show you guys, but for the sake of time, we can't. So I focused on the most important, right? And then when I bring it back to the patient, I'm like, here's what your lab tests show. Your lab tests show that you've got overgrowth of good bacteria and bad bacteria, and you have some pathogenic bacteria and parasites. So we need to remove them. And that they'll get that right away. They're right on board. They want it out of their bodies, right? And so we started her with antimicrobial support, and the remove phase really consisted of some natural antibiotics and some prescription antibiotics. So I really like Canabactin AR and BR. Those are natural antimicrobials. I usually have patients take them anywhere from like 6 to 8 weeks. And then I also, because she had the parasites, now it depends what parasite there is on how you want to remove it. And there's natural ways to do it, but this is where I do mix Eastern and Western medicine. And I know that the 2 parasites she had were especially receptive to metronidazole. It was recommended, and even the test showed they did a sensitivity on her microbiome to see a culture and sensitivity to see if metronidazole would be effective or not. They compared a few different prescription antimicrobials, and metronidazole was effective on both the parasites she had per their testing. So that culture and sensitivity was really important. So I decided we're going to do a big remove phase. We're not just going to do metronidazole. We're going to do that and the Canabactin A and B. So we did a mix of natural and prescription antibiotic. I always explain to them that this is a process and you're going to have die off. And die off is literally when those microbes die. And you might feel a little punky, a little off. And I let them know this should be just a few days. It should pass. After you get about 3 or 4 days into this whole remove phase, that should pass. So for some folks, it lasts a little longer, but I've been pretty good with saying the die-off symptoms usually are 3 or 4 days. But I let them know it's really important they take a binder with the antimicrobials, because I let them know what we've killed and gotten, we've killed off the bad guys, right? We've killed off the bad bacteria, the overgrowth bacteria, the parasites, literally. But now we have to bind them up into the stool and evacuate them out of the body, right? And that binder, so I use Ultra Binder and Quicksilver, I believe is the brand. All of my supplements, I go through Fullscript for all of my supplements because they usually have the high quality, good supplements. And that's another income stream for your practice, just on a different note. So anyway, I had her take the Canabactin AR, BR, metronidazole, and the binder, because I told her the binder binds up all those dead microbiome and helps you evacuate it through your stool. So we got her on that right away. We went with a good 6-week regimen for her. Now, the metronidazole was only 10 days and only recommended for 10 days for the treatment of that parasite. Again, that's where I did some mixing of East meets West medicine. And then I also had her on her daily supportive, what I call core supplements, because this is exactly what Dr. Tao was talking about when he's talking about give her that fish oil for inflammation, give her that CoQ10. I usually do CoQ10 or ubiquinol because that's very supportive with hypothyroid patients. And as we age, we make less, right? So that's going to help them with energy. Coenzyme Q10 or ubiquinol, at the cellular level, it helps with gas exchange, but it also protects the heart, protects blood pressure, and it helps with energy. I also had her on turmeric, 500 to 1,000. She wasn't previously on turmeric, but she was previously on the multivitamin with B12 fish oil. I added in the CoQ10 and turmeric for her, and she was already on vitamin D3. We knew from some of the labs I drawed, I wanted to raise her B12. So I went with 1 by pure encapsulation because it's got like 500 micrograms of B12 in it. And then, I'm sorry, I went out of order here. I also had her do 1 scoop of fiber and 1 scoop of collagen whenever she wanted through the day, but a scoop of each. I like Sun Fiber. It's a good brand. It's available on FullScript. There's all kinds of good brands of fiber out there, but it is more of a soluble fiber. So it's not going to cause any GI distress really. And it mixes up really good. And then a scoop of collagen, which I like the Designs for Health multi-collagen. And she puts a scoop of each in her mushroom coffee that she has in the morning. And that's how she gets those in. So she's still stayed on her daily supportive supplements, but we did add in CoQ10 and we did add in turmeric to add in that extra anti-inflammatory. And we had her on the remove. So this was what she did basically for, 6 weeks. Now on the supportive supplements, I think I pretty much hit all of those. She needed the B12. She wasn't super low, but we gave her the B12 because that's going to support energy, metabolism, red blood cell production, and nerve function. The fish oil Dr. Tal just gave a great reason on why she needs fish oil. Plus the typical American diet is pretty deficient in omega-3, right? We get way too much omega-6, not enough omega-3. This helps with that balance. CoQ10, I talked to you about that. Turmeric, we talked about that. Vitamin D3, she was at a good level, just kept her on it. But again, vitamin D has a lot to do with hormone and immune system regulation and can affect mood and energy and, of course, bone health, right? I also then had her on HPA Adapt, and that supports a stress response cortisol balance for like a more resilient immune regulation. So those were those supportive supplements. The second part of the treatment. So now we're moving on. So at bedtime, I had her, first of all, the core supplements I had her take after a meal. So the vitamin D, the fish oil, the turmeric, that whole little, one of my patients, she called it her daily handful. And I kind of liked that because I'm like, yeah, so always take those after a meal because those things need food to absorb. You have fat soluble vitamins A, D, E, and K. They need that food. They need that fat to absorb into the body, right? Then you have other herbs and things that I have her on that need food for good absorption. So anyway, she took that daily with a meal. Now at nighttime, I had her on magnesium just for general support. Magnesium plays a role in about every cellular function you can think of when it comes to your metabolism. So if you look at like a metabolomics test from Genova, or even just the Krebs cycle from any of these guys, you'll see magnesium plays a big role in converting food to energy. So carbs, fats, proteins, all of that requires magnesium. And traditionally, our diets aren't really rich in magnesium. So I try to look for where's the gap in the diet. And we can almost bet that most of us aren't getting enough magnesium from a regular everyday diet. And then also I had her go on DHEA oral 10 milligrams every other night to start to support those. She has a lower normal DHEA level. She's also postmenopausal and having a few little bit of symptoms with that. Bringing that DHEA level up gently is fine to do. And in women, like 5 up to 15 milligrams per the studies, there's the Journal of Clinical Endocrinology, if you Google that, has some studies on DHEA dosing. There's no set DHEA dosing, so it can be really tricky. But think of it this way. Men can have more than women because men have a lot more testosterone than women, and women have a lot less testosterone. DHEA does convert some into testosterone, you'll find. With men and women, it'll convert over to progesterone a little bit too, and sometimes in men a little bit into estrogen. So we have to be careful what it converts over to. In small doses, it can be miraculous though. So don't shy away from it. I think a lot of providers really shy away from it, and I don't really understand why, because the data out there is actually really good on DHEA. And there's even been some studies on DHEA that show it to be cancer preventative for a lot of different cancers. So I think we still need to learn a lot more about DHEA, but just start low, go slow. And, again, she's on a 10 milligram dose every other night, just building that up. Now, she was also on some compounded hormones from her other provider, estrogen and progesterone. And that's why her levels were good when they were tested, or were in a range where she felt good and she wasn't symptomatic. So I continued her on bioidentical hormones of progesterone and estrogen. And then she was already taking low dose naltrexone, which, once we get through all this to the end, we end up stopping that. The low dose naltrexone is for inflammation. There's been a lot of good data there. Oh, I'm so sorry. I see some questions here. Are you concerned about liver injury with turmeric? No, because her liver enzymes were fine. And I have yet to find in decades of practice of people taking turmeric that it's messed with their liver enzymes. So no, I'm not worried about it. And I do check their liver enzymes. Now, if she had compromised liver enzymes, that would change everything, right? And then do you give sun fiber right away, even with dysbiosis? Yeah, get the fiber going. Yep. Because the fiber is what's going to help move that bad microbiome out of there. So fiber and water are keys to this. Fiber helps actually with that detoxing of the gut as far as binding the toxins and getting it out of there. So that's why we need fiber. And then another question, is it always best to take DHEA at night or just for this patient? That's a very good question. And I like to I think of it like insulin. So you can have basal doses, and then you can have little titrated doses if you're trying to really correct HPA axis, and that's for a different time. I have another case study on that, actually. So you can do little baby doses of DHEA at specific times, and there's protocols and studies on this. And that would be a time when you kind of titrate baby doses throughout the day if you're dealing with really high cortisol levels and you're trying to get them back on like a normal pathway. Now, if you're just trying to give a bolus dose, like if you're treating like for her postmenopausal type of symptoms, then at night, I like at night. The reason why I like at night is DHEA kind of is your counterbalance to cortisol. It can be a little bit relaxing. And your cortisol spike, you really don't want to give the DHEA in the morning when you're wanting to have the cortisol spike, because that might mess with your morning cortisol spike. So remember, you want your cortisol to spike in the morning and come down gradually throughout the day. And so it makes perfect sense because your cortisol drops naturally at night. That's a great time for that DHEA to go ahead and rise up. And as that DHEA rises up, then it's not messing with the morning cortisol spike. Now, the DHEA is also building up a little bit in the body like a hormone, right? So you do want to, if you're going to give it to a patient, test them before and after to be sure that, you're not getting them out of normal range, number one, and that they're not having some weird side effects. That's why you start low and go slow with DHEA. If you go too high too quick, you can mess with some real big hormone imbalances. And again, that's kind of another subject. At what point would you stop the low dose naltrexone? I know once the inflammation is down, but what tests do you look at? So we didn't stop it yet. So we've stopped. She is now off of it, but she is now past that gut protocol. So really, there's not a magic line in the sand, but essentially she's not on it anymore because she felt so good. And she was like, I said, the only way we're going to know if you don't need this anymore is if you stop taking it. And there's no indication, like her complete blood cell count, if you measure the last three, so the monophils, the basophils, and the eosinophils on a complete blood count, if those add up to higher than 10, you've got some body inflammation. Hers did not. And so I took her off, plus she was just feeling good. So you can look at numbers, but I say look at numbers and the patient. Never just treat to numbers alone, because that is just not the best idea. That's kind of like, medicine 101. You got to look at the patient, not just the numbers. So it's a great question, but we took her off because she was feeling so good, but we didn't take her off yet. So at this point in time, I'm going to zoom back in. She was taking low dose naltrexone. methotrexate and hydroxychloroquine and Orencia. The methotrexate, hydroxychloroquine, and Orencia were not prescribed by me. Those are prescribed by her endocrinologist. I have a good feeling we could pull her off of everything but the thyroid hormones, and take a stab at seeing if she's in remission, like Dr. Tao was talking about, because I really feel like she probably is. I feel like my hypothesis is that she had a really bad microbiome for a really long time, and that is probably what brought the RA and the Hashimoto's on with such force. Anyway, nutrition. She was not filtering her water. She was drinking tap water, and that's just not good. So I got her on filtered water, and I have it's a smart phrase in my electronic medical record that blows in like good choices for water filters. And so she started filtering her water and drinking 100 ounces a day. And I always remind patients, your biggest detoxer every day is the water you drink. So detox 101, start with water. Forget about everything else and drink good filtered water. Then go on to the next thing. And then she really ate pretty healthy. I mean, she was already seeing a functional medicine provider and was feeling not horrible, just not 100%, right? So hands down with her and with most of my patients, depending on issues they're having, I will go with Mediterranean diet. I went with Mediterranean diet with her because she wasn't having trouble. Now, here's the caveat. If somebody is really having severe symptoms with food and like after they eat raw, like veggies and fruit, if they really get symptomatic, they might need to go on a low insoluble fiber diet for a little while you're in the gut healing phase. So anytime somebody comes back like this, that's got a microbiome that's not balanced, that we need to treat, I always ask her, are you having trouble with raw fruits and veggies? No, she said, no, I'm not. It's just, I can eat pretty much anything. It's just, I don't feel the best all the time, regardless of what I eat. So we talked, and Mediterranean diet really intrigued her. So that's what we went with. If you look at the Mediterranean diet, there's an oldways.org, and they have a Mediterranean diet food pyramid. And I always give that to my patients, and it shows like the bottom level is all plant foods. And then it goes up to the healthy proteins and healthy fats. You've got your olive oils, your fishes, your poultry type of things. And then at the top is like the red meat and the sweets, right? So it's not like they can't ever have a treat. We're human. We deserve treats, but less. And then exercise. She was a daily walker anyway. So she was already doing this, but I always like to let people know, and FYI, I was an exercise physiologist before. Why not do vitamin D with K? Oh, I did. And if it didn't say that, all my patients take vitamin D3 with K2. So if it didn't say that on there, it's on there, just so you know. So I was an exercise physiologist before I did any of this stuff. And one tip I always give people is, when you're thinking about that low impact exercise and you're getting into your target heart rate zone, you're going to start using fat for fuel at about 15 minutes if you're otherwise pretty healthy individual. So I always let people know, that yes, even short bouts of exercise are great, but if you're looking for fat loss, you need at least, a good 30-minute workout session, because then you're getting 15 minutes of fat burning, right? So, and lower target heart rate zone is where you're going to burn more of that fat. So she was already doing a great job of that, and she wasn't overweight, probably because she was walking every day and watching her diet. So just kind of tweaked things with her. Again, the HPA access support was the magnesium and DHEA at night. Talked about all that. So let's fast forward. So now we're in the 6-week follow-up. So 6-week follow-up, she has pretty much completed, she definitely completed the metronidazole, the canabactin A and B. She completed the whole remove phase. She said, I never knew how gassy I was. And she said, I really feel so good. She said to me, she felt light. Her stomach felt light. She didn't feel heavy with her stomach anymore. She said that indigestion and heartburn were totally resolved. Um, it was time to transition her to the replace phase. And we did a lot of different looks at different probiotics that are out there based on kind of what would support a good, healthy, balanced microbiome through time. And with her, I ended up with a 10 billion Gyrodophilis probiotic. I actually had her double that for the first 3 weeks to get about 20 billion units in, and then go down to just the 10, just so we can really get those good bacteria going and present in the gut. Again, reinforced a polyphenol rich diet, which that is Mediterranean diet. So fiber, high fiber, the fruits, the veggies. And she continued her full wellness plan. So then we had an 8-week follow-up. She had improvements, no setbacks, tolerated probiotics well. Again, adhering to all of the things. So she really had a big improvement. And that's when she asked me, well, can I go off at least the low dose naltrexone? I'm like, well, yeah, let's try it. You're feeling great. I am always in favor if a patient's feeling good and it makes logical sense to come off a medicine they might not need. Let's try it. Let's get you off that medicine. And she has been fine off of the low dose naltrexone, which is why I'm wondering if she might even be in remission if we pull back on some of her RA medications. That's between her and her endocrinologist. So I don't see her for that per se, but I've got her supported really, really well, where I really think she could trial off those meds and probably do very well. Again, that's between her and her endocrinologist. As far as going down on like NP thyroid or anything like that, I don't really feel that we're at that point because her thyroid labs are still normal. Sometimes there's enough damage done to the thyroid that they're not going to necessarily go into remission. It kind of depends on what disease process we're looking at and how long they've had it. Yeah, so that was her in a nutshell. So I'll turn it back over to Dr. Tal. I hope that was interesting for you.
Yes, so I'm so glad that you brought it up, because there's some really good questions, which I love.
Yes.
I think that's awesome. So I think one of the things that you talked about that we're really interested again is that, and if I just take like an overview of everything you talked about, was the combining together the different approaches, right? The nutritional, dietary supplements, like just even, and now there's a lot that going on here, right? Obviously, there's lots of stuff that are going on here. In terms of the treatment protocols, there's also a lot of stuff that we can integrate. And sometimes it depends on where the patient is in terms of their level of readiness.
Yeah.
For example, you can look, we brought the whole treatment protocol for all of you so you can see how a primary care practitioner does this in their practice. But you don't have to do the whole scale of, there's so many tools that you learn in the functional or integrative medicine programs. And so you can even pick one. You can say like, okay, maybe you're not ready to take like 5 or 6 different supplements. Okay, maybe let's just focus on 1 or 2, right? For the next 2 weeks or the next 30 days. And then patient comes back, they're taking it, everything's fine, great. Maybe we'll just add 1 more, right? So it's always important to check in with your patient. How much are they willing to do? That's also really, really important. For example, lots of my patients, I would just tell them, start with a nice little 10 minutes walk after lunch. Just walk around the block for 10 minutes, right? Do that for 30 days, then come back. We'll see what else we can integrate. And so sometimes we just got to do baby steps, right?
Yeah, and I'm sorry, just to kind of let you know too, I wanted to add to what you're saying. There's sometimes when if I do the remove phase and they don't want to do the other supportive supplements, I'll skinny that way down because it's a lot of antibiotics to take, whether you're doing natural and the binder and all of that. So I just want to underline and underscore Dr. Tao's point of check in with the patient that they're not overwhelmed. Like, don't have them do too much or they won't do it, basically.
Exactly. And in many cases, that's what we see in practice. So even though in my practice, we would have programs from $450 appointment to $12,000 programs, we always have to check with the patient. Where are they in terms of their level of commitment to diet, lifestyle, supplements, whatever. Sometimes it's also finances. Like we had lots of patients that are really interesting. Like they would come in, single moms, lots of older folks on either disability or maybe Social Security income. And so we had to have a conversation with them and say, okay, what's your monthly budget? If we're going to be putting this treatment plan together, how much can you afford? And they'll tell you. Some of them, like we had patients that would say, if I come to see you once a month and it's going to be $250 or $350 for a practitioner, one of my team members, it's like, how much more money would you have left for supplements, right? And they would say, oh, I can only do $100 a month, or I can only do $200 a month, or I can, whatever it is that they can do, right? And at that point, that's where your skills, the time you invested in your skills really shines. Because I'll give you an example. For inflammation, right? For patient coming in to see me and they say, I got rheumatoid arthritis, there's probably like 7 or 8 different nutraceutical compounds, botanical compounds, nutritional compounds that I can pick from. And so your expertise will shine when you understand how each one of those work. You have a good understanding of the pathways. With every one of those protocols, if you understand how it works, you can say, well, you know what? If we invest all our efforts and resources into this like one thing, this is going to get us the best outcome. And that's why it's important to really dive deeper into this. And that's also why you have mentors like Dr. Kim, Dr. Esha, Dr. Chill, where you bring those case studies and they can look at it with you and do a review, and you get more clarity about your case. And also you're like, okay, maybe phase 1 do this, maybe use those supplements first, and then, or maybe give your patient a heads up. One of the things that really helped me was having a mentor. So the first few years when I went through the functional medicine training, I had no mentor, and I made all sorts of mistakes, right? I never forget the first patient that I put on a anti-candida protocol. And I didn't tell them that it's very likely they're gonna go through a die-off experience, right? Yeah. And they just thought, I don't know what they thought. They probably thought that I don't like them or something, right? I mean, they came back. Thankfully, they came back. They gave me another chance. They're like, okay, listen. I was like, how's it going on? They're like, oh, it's awful. I'm getting headaches. I'm getting there. I'm like, oh gosh. I'm like, I'm so sorry. I didn't even think about that. I was like, I did not even think about all those, this potential side effects of a completely normal treatment plan, right? Which is so. I was like, and once you have a mentor, they can give you that, okay, like watch for this, watch for that, right? It's important. And again, thankfully I was, that patient gave me a second chance. I know some patients didn't. Mm-hmm. Some patients didn't come back. It can happen, but that's where you're here. That's where you're here developing your skills, so your patients do come back, so the patients do trust you, and you do get really great results. Did we talk about the results of this case?
Yeah.
Okay, great.
Yeah, so she just, she felt.
Yes, that's the follow-up picture. Yes. Yeah.
all the follow-up stuff, like she is really, I really do think that I wonder if, the gut situation is really what spurred a lot of this on. And now that we've cleaned a lot of it up, I personally think she should try, going off the rheumatoid meds, or at least maybe, coming off one or two at a time to see how things go. But again, that's where, you can let the patient know, hey, we've got you shaped up real good from a functional medicine standpoint. Now you can have a conversation with your endocrinologist or your primary care or whoever that is about potentially coming off of medicine, because, that can happen a lot with chronic disease,
Yes, I always, and I love that approach, because it's always a combined team approach that we're trying to do. We're not replacing their either specialist or primary care. We're not there to replace those professionals. Of course, if you are a primary care practitioner, you can combine all of this approach. But we always used to tell our patients, our job really in the next 6 months is to figure out what doesn't work in your body, what's causing you sickness or contributing to your disease. Try to figure out how we can remove those insulting factors, and then from there, really stimulate your body to try to get you back as close as we possibly can to, 10 years ago when you were healthy, or 20 years ago before you had all these symptoms and sickness, right? And it's a nice feeling for a patient to try to think about, oh, okay, if we can get me closer and closer to that would be amazing. And that's, of course, where, it's life-changing. When you help your patient to get into remission, it's life-changing.
Yeah.
And if you help them do that with even less depending on net dependency on medication, that means that you have done something truly great, which is you allow their body to do what it needs to do naturally without being dependent on drugs, right? So this is again where, if you loved kind of like this content of, like, the clinical case study and all of that, and the root causes, I would highly recommend Dr. Kim's program. So she's starting in January, the 6th week of January, and she's going to bring in over 20 years of experience, and everything she have learned in her training in functional and integrative medicine. She's going to bring it, and she's going to do it. It's a 4 months. It's concentrated. You're going to have a class with her every week where she dives deeper into like one factor in functional medicine. And then, so it's about like an hour to an hour and a half. It's going to be on Mondays evening. And then you also there's additional, I think it's like over probably around 10 different presenters, other physicians, other clinicians who have prepared for you the additional 2 to 3 hours every week. So that's on demand. So you can, on your own schedule, you can log in. Some people will log in on the weekend, or doing half an hour here or an hour there. But in 4 months, you get certified. You learn the whole system. We go through case studies. The 4th month, we do a lot of clinical case studies. You get mentorship with Dr. Kim and Dr. Esha, which are, they will do case studies, like virtual rounds with you. So that's going to be where you're going to get also all the clinical tools. So I highly recommend it. It's going to be a lot of fun. You're going to learn a lot. And in 4 months, you learn the whole system and get certified. So that's going to be a lot of fun to do that. Transformative, I would say, right, Dr. Kim? I mean, it's like
you're going to feel like, why? This is what I wanted to do from the beginning, is help people's bodies to heal naturally, because that's what the body's designed to do. We're just putting all the dominoes in place to make that happen with functional medicine. So yeah. And I was also going to say, the coaching calls, that's where you really get to put everything to practice. And so I highly recommend them, because you'll learn a lot of theory and it's great. And then on the coaching call, you'll get to put that to practice, and you'll actually go through a case. Maybe it's you, maybe it's, a patient you're working with. And we then take all of that stuff you're learning and just put it on paper, and we start utilizing it and making it real, and it's fun.
Yes. And that's the combination that, we're all looking for, right? And each of you in our functional medicine programs, you're gonna get, that's like I call the perfect combination for practicing successfully, is the have the training, so you're not just half doing it, right? And I've seen practitioners that they call the labs, they'll call Genova or doctor's data, and they're like, what do I do with this patient? Just got the results. What do I do with this patient? And that's not a good, you don't want to do that to your patients, right? So get the full training, and then use the mentorship we provided to you. Use the mentorship, connect with our mentors, do case studies. That's where you got to really put everything to apply everything, put everything to clinical use. And then the third part is you get all the protocols. So when a patient comes in and they say, oh, I got rheumatoid arthritis, you're like, no problem, right? And you pull up your phone, the treatment protocol app, and or one of our clinical guides, and you're like, no problem. Here's the protocols. Here's what we're gonna do. Step number 1, step number 2. So we give you the clinical tools, the mentorship. We are there with you, and third, you get the training, which is really important. If you just get the training, but you don't have anybody there to, watch over your shoulder and kind of guide you, it kind of reminds me the first time I learned how to do an IV. Put an IV in, right? It was an awful experience for myself and the other person, I'm sure, because I was like, okay, I saw how the instructor does it, and I'm like, okay, well, I pretty much I learned it, like I saw it, I learned from actually watching it, right? But then when I actually try to do it myself, to apply it, I was like, oh, it was like first time, second time, third time. It was not right. It was like a gap here between like, watching it, how the instructor does, and actually doing it. But thankfully, that's where mentorship comes in, because the instructor saw me and he said, well, Tal, you got to hold it like this, right? And you got to do this. And when you aim, you got to do this. And I think with that correction and guidance, I was able to get it right. I was like, wow, that's like makes a big difference. So have somebody working with you to show you how to do it. Somebody who's already done it, somebody's experienced. That's where we have all these resources. So I think this was a little bit longer class than we typically do on Wednesday evening, but we both, me and Dr. Kim, are really passionate about kind of sharing everything that we're doing that has been successful. And I want to show you a real picture real quick. This is the functional medicine accelerator. So if you're interested, you can get some more information. We'll post a link in the chat. But this is the functional medicine accelerator. You get the evaluation tools, the quick start guide, everything that Dr. Kim uses in her practice, you're going to have access to. And then the training is 4 months. And some of you are in our longer trainings, which are great because they have also subspecialty classes. But if you want 4 months focused and get the support, this is going to be really good for you. Dr. Kim, I really appreciate you being here with us. It's always an honor.
Same. Ditto. It's so much fun. I love it.
Yes, and I look forward to it. We got another case study, I think, coming up next week on Wednesday. I think on Wednesday next week we got another interesting case study, a little bit different.
One more, yeah.
Yes, so we got one more, and then we're sort of starting to finalize the registration in the next couple of weeks. We are offering a scholarship because we're promoting this program during the holidays. So we're like, okay, we're extending a scholarship. So if you're interested, reach out to us. Our admission advisor will be happy to give you information. But we already have practitioners enrolled in the class. So in the next couple of weeks, we're going to finalize it and close the enrollment. So if you are interested, join us. It's going to be a lot of fun. You're going to learn a lot. I promise you're going to learn a lot of things. You're going to learn the entire system. Dr. Kim is going to be there to walk you through everything, share her experience, and then the clinical tools will show you exactly where do I get my labs, my supplements, like all of that stuff. We got you covered. We even included the practice forms. So your disclaimer form, your intake forms, like everything you need to just get started. So
it's amazing. And they're fillable. So you can just send them to the patient and they just fill them in.
Yeah, absolutely. Especially the health survey, the functional health survey. I use that all the time. My practitioners, my nurse practitioner, my physicians use it all the time. Instead of walking into the room with a patient and you have to do the 200 questions for like an hour and a half, I just give them the evaluation tool. I'm like, here, fill it up and send it to me or bring it with you 10 minutes before. And then I look at it, I'm like, okay, now I can see the signs and symptoms of the 2 top root causes. Now I know where to focus on, right? So use all the tools. It's there for you guys. Go into your functional medicine platform, download those tools, start using it. That's what we created for. So I want to thank all of you for being here, advancing your skills. And I want to thank again, Dr. Kim, for being here with us.
Thank you, everybody.
And I want to thank our media team. I want to thank Jacob also for allowing us to be here with you wherever we are. And I hope you have a good evening. Take care of yourself, and we'll see you in the next class.